Happy Sabbath, everyone. It is wonderful, wonderful to connect with you tonight. We have a special program, and I know that you will be blessed tonight. So, once again, welcome. This is the indicator. Today is April Friday 16, and we are just happy to have you. Like I just told you, tonight will be a special program. We have special guests with us tonight, and I know you will be blessed. We have seen news and read articles about this vaccine and how this will change different things. Just a lot of questions. I know, just like me, you have questions and concerns. Well, tonight we hope and pray that some of those questions will be addressed and you will be able to make smart decisions. We have people that we can trust, people that we know, professional, and we are so happy for the fact that they are with us tonight. So welcome once again, and we just want to start with a word of prayer, and then we'll ask Pastor Crespo, who is with us tonight, to join us shortly. Let's just pray now. Our Father, we thank you so much for your blessings. We thank you for who you are. I thank you, Father, for the way that you have provided for us, and we just want to ask you, Lord, for your presence in our midst. There's a lot of questions. There's a lot of concerns with our brothers and sisters. And we just want to ask, Lord, to be with us as we learn and educate ourselves about this situation that all of us are facing. Be with us, Lord. Once again, it is my prayer in Jesus' name. Pastor Miguel, welcome. Thank you so much for joining us. I believe the time is running, brother. We want to just take advantage of the time that we have. I know there are people who are anxious to have some questions, but please share with us, what do we have tonight? Can you just talk to us about the program?
Well, good evening, everyone who's with us, and happy Sabbath to you all. Yeah, we have our indicator program. You know, I don't know how long we've been doing the indicator, Claudio. 7 months, something like that. This one I've received a lot of messages on this one, and so I'm sure that there are people that are going to be watching, and we want to welcome everyone. Let's get right to this, right? So we want to bring on our two guests, Dr. Beth Burkhardt and Dr. David Foote. I want to welcome you to our indicator program. If you're not familiar with the indicator was the name of a communication, kind of like a old-fashioned conference gleaner way back in the 1920s that the New York Conference had, and they called it the New York Conference Indicator. Well, we started the digital indicator version during COVID, and so it's a monthly digital magazine. We talk about updates, and we deal with topics and things like kind of what we're doing today. So I want to welcome both of you to our indicator program tonight. We want to get right into this. So normally, Brother Pastor Reynolds Rodriguez is with us. He usually brings the fire because he's young. He's got all this energy. I don't know that I can match that, but we'll do the best that we can. Tonight is an interesting program. We want to talk about the COVID vaccine. Now, there are a lot of things that are out there right now. A lot of questions people have. One of the things that I'm hoping that we can do is get away from what people are seeing on the national news and on the TV and all this, and talk to just some folks in the medical field who are local. Not saying that they know everything about everything, but I'm sure, just like as pastors, we have people come and talk to us privately about issues, questions they have. Usually it's spiritual. And with doctors, I'm sure you have private conversations with patients about this. And so they may come to you and they may ask what your thoughts are. Tonight we want to do something like that with you, but obviously in a larger setting. So let's do this. First, I want to welcome each of you. Before we get to the questions, can you just tell us a little bit about your medical background? We'll start ladies first.
Okay. So as you can tell from my name, Beth Burkhardt, I grew up here in Central New York, went to Parkview Junior Academy and Union Springs Academy, then went to Andrews University, and then came back to Central New York to go to medical school. Took a residency in ear, nose, and throat, which is a surgical subspecialty that deals with the head and neck. And I've been practicing in private practice here in Syracuse ever since 1993. I have a solo private practice. I take care of kids, grown-ups, surgical, medical, all kinds of different things. And I've had a lot of conversations about the COVID vaccine in the past few months with my patients.
Wonderful. All right, Dr. Foote.
Well, thank you very much, Pastor Crespo and Pastor Gomez, for having us, and thank you, Beth, also. So I'm a family practice physician, and I've been in the thick of this since the beginning. So I guess I have experience by just being in the line of fire from day one, and my major professor at Andrews was a virologist, so I've actually had some conversations with him. I will not pretend to be an expert, though, but we have to know what's happening. I mean, CDC gives us updates, all the time. I'm on the board with the county regarding what to do in the schools, so I have kept abreast of this. So anything I can share with you that would answer any questions, I'd be glad to help.
Okay, great. Well, I will tell the two of you that we're very glad that you're here. One reason being is that people have been asking us about the COVID vaccine, even asking us if they should take the vaccine. Mm-hmm. And, why coming to a pastor asking them medical advice is that's dangerous. So we're very glad to have you here. So let's do this. We have questions, but can I just, one thing that is not on here, I'm just curious, how do doctors, how do you get information regarding the vaccine and the virus? I mean, do you get it through periodicals, or do you get it through like a Zoom meeting? How do you get this information first?
Well, I in a lot of different ways. I'm a news junkie, so I check the news feed multiple times every day because I want to know what my patients are seeing as well. There'll be a lot of that barking, hopefully. But I have been on several seminars and Zoom meetings with our local county health commissioner. I'm sure, Dave, you've worked very closely with yours. And at Upstate, we're really privileged in that we have an infectious disease doctor, Stephen Thomas, who is the lead clinical investigator in the development of the Pfizer vaccine. So I've seen 3 of his presentations, and they've been phenomenal. And I sat in on a chemistry seminar last night from Andrews, where a research scientist talked about the piece of the vaccine development from Pfizer that involved the little fat particle that carries the messenger RNA and how they developed that. So I have really reached out to find those kind of resources. Plus, we get tons of emails, from the CDC and from the County Medical Society and the State Medical Society to keep us up to date. And we browse the literature that's online because so much stuff is coming out in pre-publication. It's before it's even hit the journals. We're seeing it online and trying to figure out which of this stuff is really widely applicable, which might be something that's not going to really pan out in terms of a complication or a risk or an interaction. So it's a very fluid information environment, but we just have to keep your eyes open to every source. Dave, what are you seeing on the front lines? You treat COVID patients. I don't.
Well, fortunately, treatment has really improved in since the beginning. As you know, the death rates have really gone down. So that's the good news as far as if you've got the disease. But so I get my information. Our local hospital. I'm still on the staff, and so treatment side of it comes from the hospital, and the state also informs us as well as the federal government. So I get, probably 10 emails a day. I hate to say it. I don't read them all, but I look at the ones that I feel are most important for, my practice. Beth and I've been in practice probably longer than her, and we've lived through SARS, and the scare of Ebola. We didn't actually have any Ebola here, but this has been something that I've had on my wall for probably 8 years about a pandemic that was, going to come. We just, it talked about what we needed to do, and we had to have PPE and all that. And so, it's been a long time coming, even though it seems like it's all just new this year. So I think we all have had, the history of medicine, but we've also had our history of the diseases as they gotten more intense in the last few years.
Okay. Well, let's get to some questions here. First question, and again, whichever one wants to take it first, love to hear from both of you on this. If you could just take a moment and explain, which I thought was amazing when the first time I heard this, how does the immune system work with vaccines? And I mean the old style vaccines, but when we talk about, how does the immune system just work in conjunction with vaccines?
Go ahead, Dave. Give it a shot.
You mentioned old vaccines, so you're talking about the the attenuated viruses were the first. Basically, they took a active virus and made it inactive, and then put it in your body, and the body would recognize it as foreign and form antibodies against it. Then they've refined that over the years, so they had subparticles of the virus. And that helped out, because when you give the whole virus, you have lots of proteins and lots of DNA or RNA, depending on. And so the immune system really gets a little too much information. And so they knew that every virus has its soft underbelly, and the coronavirus was a spike protein. So it's all they needed was a spike protein. When you add all the viral particles, it does confuse the immune system somewhat. It doesn't know really what the major weakness is. So we can get a much higher level of antibodies with the newer vaccines, which are the RNA, and then there's the DNA viruses, but that's really it's a viral vector, non-infectious virus. It's a complicated, long 4 names, but that's what the J&J and the AstraZeneca and the Sputnik 5 are. They're all viral vector DNA vaccines. So the newer ones have an advantage in that they are very specific as to what is the weakness of that pathogen and how to attack it. Also, the new ones mimic a natural infection because they go in the cell. The cell eventually ruptures with these particles, so it stimulates not only the what we call the humoral or the antibody, but also the T cells, the killer T cells and the helper T cells. So the newer ones are just so much better than the old ones. We all knew the flu vaccine was about 50%. And the newer ones are just so much more, the efficacy is so much greater. So that's kind of like a short history of it. I guess, if you want to look at the last two, the main thing is the RNA is much simpler because you just have a glob of fat around a messenger RNA, which gets in the cell, but the other ones have to have a vector, which is DNA is put in a viral shell. That shell has to go through the membrane of the cell and then into the nucleus. Then it has to be transcribed out. So it's a much more complicated procedure, and the science to get it to go to get the body to accept it to cross all these membranes and back out again is pretty complicated. So, the messenger RNA ones are much simpler, and you can ramp these up very quickly within months.
Okay, so some of that was admittedly over my head. my question with regards to, because you mentioned this, so there's the old style vaccine, which now they've switched to this mRNA style. Is that a proper way to describe it? Okay.
Yeah.
That's one of them. Yeah.
Does that mean that are all vaccines going to come out using the mRNA style? So
No,
for the flu vaccine and some of these other things,
I don't know.
MMR,
Yeah. I don't know about that. I think each disease is going to be approached with a lot of different approaches, because that's definitely what happened with COVID. All these companies got government funding to say, throw your best at it. And then what rose to the top was the 2 mRNA vaccines, the Moderna and the Pfizer. And then the AstraZeneca and the J&J and the Soviet one are you take a virus that doesn't really hurt anybody and you put some DNA in it. So I don't think every vaccine is going to be an mRNA vaccine necessarily, but it is really a very effective, very elegant, very simple concept.
it's simpler than the old way.
Yes.
That's news to me. I didn't know that.
It's more refined. Like Dave said, if you give somebody a partly killed or a killed virus, you put that whole thing in a person's body, and your immune system reacts to many of the little bits and pieces. But with the mRNA, we tell the body only make antibodies to one thing and make tons of them, because that's the best thing to make an antibody to, because we know how this virus works. And so it focuses the reaction of the body's immune system to make an antibody that's going to hit the virus the most effectively. So it simplifies the process.
All right. Now, Pastor Claudia, I know you had a question, but
Yes.
there was one that came up, and I want to sum it up. It's a little bit long. The idea, or the main point of the question, if I understand it right, is talking about the coating that covers. I'm assuming the fat coating, the lipid coating, that it's maybe destructive to certain parts of the body. Is there anything that you have to share on that?
So yeah, the seminar I watched last night was specifically about the lipids in that coating, the 4 different lipids, and probably the one your questioner is talking about is PEG, or polyethylene glycol. That is a component of the lipid, and there are people who are sensitive to polyethylene glycol, a very tiny percentage of people. That was a discussion we had in last night's seminar. And maybe, Dave, you've got patients who know they have a sensitivity to polyethylene glycol, or who think they have a sensitivity to polyethylene glycol. I don't know. But the researcher last night said there's at least 12 different medications that use polyethylene glycol to move that medication or that virus, that vaccine, into the cells, because it works really well at crossing into cells. There have not been any significant reactions to polyethylene glycol in millions of people who've gotten the medications that contain polyethylene glycol. But there are some people who have reactions. So that's the piece of it that some people say, oh, I'm not going to take this vaccine because it has that in it. And if you specifically have a known reaction to it, then you need to talk to your doctor about it. But in general, no, it does not damage tissue.
Okay.
I would just say, the way I understand these, now I'm somewhat, I'm not a scientist in this, but, the virus does kill the cell. I mean, that's how it replicates. It comes in your cytoplasm, either an RNA and directly in the cytoplasm, or DNA goes in your nucleus, and eventually it creates a bunch of viral particles. It creates more DNA, and it creates all the different proteins necessary. Eventually the cell ruptures, and then these leave. That cell is going to die. Not that I'm discounting any chemicals that we put in our body, but the way for a proper immune reaction to work is that this protein then has to leave that cell, and the cell will die that releases it. Fortunately, they only put a few of these in your body, so not many cells die, and they release the protein, and that forms the perfect natural way of beating an infection.
Okay. Pastor Claudia?
Well, yeah, thank you. Once again, we are in the indicator tonight. We have a special program. And I know that already we've seen some different questions here. So thank you so much for them. But I do have a question. I know a lot of people are concerned because they have these questions about the timing of the vaccine. Some people say that this was too soon. How can they develop a vaccine so soon? How effective that is, especially when they compare with other vaccines that has been in the market for so longer. So can you just explain to us, the how effective it is for, with a new vaccine, basically, and some people feel that the time to really test and come up with a positive conclusion for us to say, yes, you can go ahead and take this. Can you just explain to us about the timing of it, how effective that is, and why, with the development with some other vaccines that took more longer, how this is effective for us in a short period of time? I guess people have concerns about that, the timing of it.
That question came up in the seminar last night at Andrews, because this researcher was intimately involved with all of that. And one thing he said, he was with Pfizer, and they are partnered with BioNTech, which is a German company. The mRNA vaccine technology was already existed between those two companies before COVID happened. So they knew how to make mRNA vaccines already. They'd already developed that. So then all they had to do was learn the recipe for the protein. And that virus entire genetic code was put on the internet in March of 2020. And so that was done extremely quickly. One reason why it happened so quickly is the scientists of the entire world were working on this problem. China, Japan, US, Canada, Germany, every single country that had a program that was up to speed in this sort of technology jumped on it. Plus, they had no funding risk. The US government said, we're going to pay whatever it takes to get this vaccine, and you're not going to lose money on it. So they jumped on that too. And it's a fairly simple concept. They just needed the recipe for the RNA. Once they got that, they had to figure out how to make the fat capsule. And he, showed how that research went very quickly. And then they needed to get tens of thousands of people to join the phase 1, phase 2, and then phase 3 and 4 needed the tens of thousands of people. He said they had people lining up to join their phase 3 and phase 4 trials. They got 40,000 people within weeks. So sometimes it takes a very long time to get a lot of people in your trial. It did not take any time at all to get the people in their trial. So yes, it was extremely fast. You would almost look at it and say, wow, this was miraculous that they succeeded at it, that all of the pieces came together. But the science behind it has been fascinating, and it's been very interesting to me to talk to people who are involved in the development. Dr. Thomas and Dr. Pak was the research scientist that I talked to yesterday. But I still have patients say to me the same thing. This was developed too quickly. It can't be real. And I said that last year, say April, May, June. I said, are you kidding? There's going to be a vaccine that quickly? So I was skeptical as well. I don't know, David, what experience have you had with that particular question?
Yeah, I would say there's a fair number of people that are skeptical. I think as time has gone on, though, that skepticism, if they were sitting on the fence, they've already seen that, if 100 million people got it, that's a good sign. I mean, the proof is in the pudding. And the evidence from Israel and from all the places that got it early, that it's more efficacious than actually they were saying it was. So it's actually better than they said it was. No one has actually died from COVID who's had a vaccine. And yeah, you can get COVID, but most of the time you find it just by a swab. The person has no concept that they have an infection. It's just some hospitals require you to be swabbed every week, and they find it. It's about, it's 5% of the people will pick up the virus, but they don't even know they have an infection. So it's an amazing, amazing virus. Just want to go over it again about the phases. The first phase of a trial is to check the toxicity. The second phase is to check the efficacy. And then the third phase is to compare it with what's out there. The first three phases were completed in full standard of scientific literature, just like every other virus that's ever been done. So there was no shortcuts there. The only shortcut was in the stage 4, or the fourth stage, which really is is just to make sure that there's nothing they missed along the way. And so it was so spectacular that they did give them an emergency
use authorization.
Authorization, but the level 4 isn't still in progress, and so we'll have all the final information that everybody needs.
When you say efficacy, when you're checking the efficacy of the drug, what are you saying? Are you checking, what is that? The safety of it?
No. The first thing they do before they put this in people is they want to make sure it's not going to cause harm. Then they check to make sure it actually works, because a lot of people say things work when they don't. So they have to actually prove it works. And once they prove it works, then they have to compare it to all the existing treatments and see, is it better than the existing treatments? Because if it's no better, they're going to throw it out the window. There's no point bringing a product out that's worse than the one you already have. So they compare it with what's available already. Finally, they have, like Beth said, they enroll tens of thousands of people, and basically they're treating these like normal patients, but monitoring them closer to see if there's anything they might have missed along the way.
So efficacy means, does it do what it's supposed to do? Is it effective?
Yes.
So let me ask some questions here, and the questions that I'm asking have come from I'm a lay person. I am not a doctor. I don't play one. So I don't even have a white coat or a stethoscope, nothing. But you watch the news, you read, you see certain things. So if I've heard that one of the side effects of the vaccine is that it can make you sterile.
Absolutely not.
Okay, so all right, so that's
a fallacy.
Okay. All right. Do you know where that may come from? In other words, I mean, is it just where does that come from? Do you know? And you probably may not know. I don't want to get into politics.
Yeah, I'm aware of where that came from, and Beth, I'm sure is too. But there's the theory that came out was there was this there's 20 amino acids in every protein. There's 900 and some proteins in the spike protein on this virus, and there's about 50 or 45 on a protein called syncytin 1, which is used in the implantation of a embryo in a woman's uterus. Somebody saw there was a faint resemblance between the spike protein amino acids and this other protein, which is used for implantation of an embryo, and they just out of the blue said, well, the virus is going to take this out. But they had no proof, and they did no scientific studies on it. It was just in their mind, they said, oh, these are kind of similar. The virus is going to take this, or the vaccine is going to take this out. It turns out, and they've done plenty of studies, including implantation studies using naive patients who've had the disease, and patients who've been vaccinated. They all have the same 75% implantation rate, and they all have the same spontaneous abortion rate. There's absolutely zero difference. So it's all a fraud.
Okay. All right. We have questions that are coming in, and for those of you who are putting in the questions, keep them coming. We're gonna throw them in as we go. We only have them for an hour, so we're gonna try and get through some of this. There is one question that I have that it's up to why, which I got to be honest with you, is frustrating. If you tell someone that they get the vaccine, but then you still got to wear the mask. It's like, why even bother? This is just, it's for, if I had hair, I'd pull it out. And I don't want to put you on the spot. I'm asking the question, and I would like for you to look at the question as if you're in your room with your patient and they ask you that question, what would your advice or response be to a frustrated patient with this issue? Because that frustrates me. I got to be honest.
So no vaccine is 100% effective. Even if it has a tiny chance that you're going to get infected with coronavirus, even though you're vaccinated, there's a small chance in any vaccinated person. Some people with a bad immune response, like people who have certain kinds of blood cancers or who are on chemotherapy, may get no protection at all from the vaccine. So you have to, and the virus is still widely prevalent. It's everywhere. So you have to have the additional protection for either yourself, if you didn't get a good immune response and you don't know, or if you could get that asymptomatic infection, never get sick because you're vaccinated, but you're going to spread you could spread the virus to a person who has no protection. Until the virus is not spreading in the community, you have to wear a mask. And the vaccine is the best way we have of stopping it from spreading in the community. But we don't have enough people vaccinated to stop it from spreading. We're all vaccinated for whooping cough and diphtheria. None of those vaccines aren't 100% effective, but we don't have to protect ourselves from that virus because it's not spreading in the community anymore. It doesn't exist in the US to any significant extent, so we don't worry about protecting ourselves from it. Once corona stops spreading in the community, we can stop wearing a mask. It's not the vaccine that's going to prevent you from getting it. The mask will prevent you from spreading it or getting it until it stops being in the air around us. And it's in the air around us.
Okay. So have either of you had this question, and that's one of the questions here, with your patients or just in having these private conversations? You know, if the virus does not have, if it's I guess if you get it, 99.7% chance of surviving the virus. If it's, I guess to a layperson, that's not a deadly virus. It's hard for me to look at it and see where everybody's all worked up about it. If that's the case, and then the vaccine, how do you, again, you're having a private conversation with a patient. How do you answer those concerns that your patient might have?
I'm not following what you said. Did you say this is not a deadly virus?
Well, I'm saying as a layperson, when I read it's 99% whatever that you're going to survive if you get it.
Yeah, but still, over 560,000 people have died from died, and most likely more than 600,000. I mean, that's excess deaths in the past year were 600,000. We know there were less flu. We know there were less heart attacks. We know there was a lot less of other diseases. So out of that 600 extra, there was even more than unaccounted for because people had heart attacks and strokes at home before they were tested. And so this was a deadly disease. I'm sorry, it was a deadly disease. You've had people in the conference who've gotten it. It's not, even when you didn't die, it was a serious disease. So, it's, I guess when you look at your immediate family, you say, well, none of us are dead. But if you have to look at all the data, and the data was it was a deadly disease. Now, I don't want to be dramatic because, 1 or 2% is not an Ebola, which is 90%. It's not a MERS, which was 30%. It's not a SARS, which was 10% fatality, but it's still a serious disease.
Okay, good. Well, thank you for answering the question. Yeah. And it's not putting you on the spot. I said, like, if you have a patient in your office and they ask you the question,
and they do bring that up.
All right.
Very good.
Is it my turn or is it your turn, Claudio? I'm sorry.
Well, if you let me, but that's fine. You're on fire. That's okay. That's all right. That's fine. Once again, everyone, we are in the indicator. This is our monthly magazine, digital magazine here at the New York conference, and we are just talking about the vaccine tonight. We have two special people with us, Dr. Beth and Dr. David. They have been sharing great information with us tonight. So we want to acknowledge you and say thank you. I know we have people on YouTube. We have people also on Facebook. So thank you so much for joining us tonight. I need to say that we have a lot of people watching right now. So thank you so much for that. I do have a question. A lot of people are concerned about the DNA. Can this vaccine really change your DNA?
Absolutely not.
Not possible. It's not even
Not
possible. That's not possible. All right. So just explain to a little bit, people like us, like Miguel, we're not doctor, but we want to learn. We want to be educated. I think that's how I feel tonight. So if you can just share with us about that.
Well, I mean, I know you might know more about the other vaccines, David, but the Pfizer and the Moderna cannot change your DNA. They do not have anything that can change DNA. What do you know about the other ones, David?
Well, just to go back to messenger RNA. Messenger RNA, the only viruses in the world that are messenger RNA that can change your DNA are HIV, because they have an enzyme which is not in your body. This is a foreign substance called reverse transcriptase. This reverse transcriptase can change messenger RNA into DNA, and it causes certain lymphatic cancers, and it causes and the viruses with this will also cause HIV, but there is no reverse transcriptase in any of these vaccines. So there's no way that the messenger RNA can cause DNA damage. Now, the J&J and the AstraZeneca and the Sputnik 5, they do inject DNA in your body. But the DNA has been clipped, so it can't replicate, and it doesn't ever combine with your DNA. So there's a few strands of this in your body. It does its thing and makes the spike protein and leaves, but it has been very carefully engineered not to form anything that combines with your DNA. And it can't replicate. It can't combine and it can't replicate. So once it creates all its protein and the cell dies of normal death, it's gone. So that DNA may last, I don't know, let's say 30 days in your body, but the messenger RNA lasts no more than a day.
So if you're worried about that, get the Moderna and get the Pfizer. There's no DNA in them.
All right.
And plus, the government didn't want to put all their eggs in one basket. So they said, make all different kinds of vaccines. Turns out that the DNA virus was better than people thought.
DNA vaccine, yeah. And for some
because,
people, they choose it.
Because when they were testing the last 10 years, these types of vaccines, mRNA always won. But the government said, look, we can't put all our eggs in one basket, so make the DNA vaccine. Turns out it was pretty darn good.
Okay.
All right. Thank you. I do have a question, Miguel. I think there's also a couple of questions on our Facebook, but I want to ask a question here because sometimes we have misinformation from everywhere and anywhere, and sometimes the idea because we are young and we are healthy that there's not a need for us to take the vaccine. What would you say about that? Can a young people of somebody who's healthy her whole life doesn't need the vaccine? What do you say?
The rest of us need you to get it because you're the ones who are spreading it. And that's really happening now, the past month. The young people are spreading it. Young people are going in the hospital. What do you tell your young patients, David?
Well, we've just now, the last week or so, young people have had an option. So I really haven't crossed that bridge too much, but I agree with you entirely. When you fight a forest fire, you got to have a fire break. You got to get the combustible material out of the path of the fire. So when you vaccinate someone, you're controlling this forest fire, which is what commonly called herd immunity. So if the virus isn't too contagious, 60% is probably enough for herd immunity. But if it's very contagious, you might have to have 70 or 80%. So we don't know exactly what that number will be. And the contagious viruses now are, since they're more contagious, are more prevalent. So you're seeing more and more of the more contagious forms of this mutation. So ultimately, I don't know how much we're going to need, but what Beth was saying before is that if once the virus stops, which is in herd immunity, we can all take our masks off. You only need about 70% of the people vaccinated, and we can all take our masks off then.
The problem with healthy young people saying, well, I'm not going to get that sick. I don't really need the vaccine. You may not get sick from it, but you provide that virus a chance to replicate millions of times when it's in your body. And that's where these really more serious variants are coming from, is the virus gets a chance to replicate in so many people that it turns into a more serious virus. And that's what's happening in Brazil right now. So the more people that get vaccinated and don't give it a chance to spread in their body, the fewer severe variants are going to get the opportunity to arise.
Is it my turn to ask a question, Claudio?
Yes. If you ask, we have a few on Facebook. So
Yeah, we do. Well, some of them are long, and actually we need to, just for the sake of time, reduce your questions down to make it easier so that we can share. So
we probably have to do a second part to this program.
Yeah.
Okay.
Can you speak just for a second about the pause on the Johnson & Johnson vaccine? And I heard there were some issues with Pfizer recently as well. Have you heard anything about that? Can you speak to it?
The evidence that's coming out is that the risk of getting blood clots from any of the vaccines is, number one, significantly lower than the risk of blood clots if you get the disease. Like you have a tenth of the risk of blood clots, roughly. If you got the disease, you got this risk of blood clots. And if you get the vaccine, you got a much tinier risk of a blood clot. And it may not be higher than the risk of blood clots in people who aren't vaccinated. So they're doing the work right now to get the numbers to figure out, is this a real increased risk of getting these blood clots or not?
The interesting thing is that, these are women in the childbearing age. It seems that estrogen is always a component of clotting. When we gave postmenopausal women estrogen in high doses, they got blood clots. So there's something about, and we don't know if these people were smokers. We do know, though, that they were women between 48 and 18, which is the childbearing age, and a lot of them were on either birth control pills or some other form of exogenous estrogen. So if I was a woman, childbearing age, I think at this point I would not take the J&J.
Okay, all right.
But there's no men that have gotten this, so right now it's all we know.
I think part of the challenge is that with some folks it's all or nothing. It's either perfect or it's not perfect.
Sure.
Perfect or bad, and that's maybe some of these issues. Let me see here. Can
I just say one more thing?
Of course.
Yesterday there were 750 people died of COVID in the U.S., not in the world, in the U.S. And you're talking about one person that died over 6 weeks of J&J vaccines, and 6 people got sick. It's not, you're not talking a lot when 700 people are dying every day.
Okay. All right. If you have had COVID, do you need the vaccine?
Yes. You can't prove you have sufficient immunity just from being sick from COVID.
Okay.
I've done the antibody test on families who all had the symptoms. Some have antibodies, some don't. And the woman that didn't want the vaccine, she didn't have the antibodies, and she was like, "Oh, check it again." So I ran it again. She did not want the vaccine, but she's hoping that she'd gotten antibodies, but she had none. You really don't know how many you get, and they tend to wane pretty quickly.
Okay. There's a question online. Confusion regarding being asymptomatic and spreading COVID. That apparently that may be a new thing, a new concept for that individual, thinking about that you can be sick but not be sick. Can you just talk a little bit about that to help maybe explain it a little bit?
David?
Yeah. Well, we all know that 98% of people had mild disease, or 95%. So I mean, and mild goes from 0 to to have a headache or some muscle aches. So asymptomatic is kind of in the eyes of the beholder, but probably that means they had some mild symptoms and just thought, I'm just tired today or something. That's what asymptomatic means. It was a very mild infection. They may not have actually gone to the doctor. They may not have actually thought it was anything more than a common cold.
But every time they sneezed or coughed or breathed, they were spreading the virus. It was still in their secretions coming out, whenever they were, if you were close to that person, your risk of exposure was significant, and they didn't even know they had the virus.
Okay. So I guess if I was understanding the question properly, I think the concept that you can actually be sick but may not feel sick.
Yeah.
But
Absolutely.
that doesn't mean you're not sick. I just confused myself, but yeah,
It doesn't mean you're not infected.
And so
you can be infected without symptoms.
Yeah. So the rapid test takes a certain number of viruses to be positive, and so that is not even accurate as to whether you have an infection. A lot of places rely on the rapid testing to get somewhere on a plane, and you can be asymptomatic and get on that plane, and that test will not pick it up. The PCR test will work down to very low levels of virus, but the rapid test requires a certain amount of viral particles to be positive. And they tell you, if you don't have symptoms, this test is not very accurate. It does right in the fine print. So it's one of those things where when you're asymptomatic, you don't carry as much virus, but you still can be contagious.
Okay. I have one question that I want to ask that I had kind of been wanting to ask, personal question. I don't want to overlook the questions that have been coming in. There's a question regarding the cycling of the PCR tests, and that they were at one rate last year. Now they're doing it at a lesser rate or something. Can you speak to this? Again, you're talking to a layperson in your office, and they're asking you this question. How would you address that?
Do you know the details of that, David? I know what they're talking about, but I don't know.
I'm sorry, I was actually I was reading something on the sidebar.
Okay. But I don't know what that person exactly is talking about, but
I think it has to do with the test, with the COVID testing.
Yeah, when you get it swabbed, there's not a lot of viral material in that swab, and for them to see is it there, they put it into a machine and it gets multiplied. And they multiply it once, and they multiply it again. They multiply it until they're sure that there's coronavirus there. And if they have to multiply it 60,000 times, well, there wasn't very much coronavirus there in the first place. But if they only have to multiply it 10 times, then there was a lot of coronavirus in your swab. The more times they have to make the machine, multiply what was in there, the less there was to begin with.
It's an amplifier. What it is.
So I don't know if the tests are doing a different level now than they did last year. That's what this person is implying, but I don't know. David's saying no, they're not doing a different level now than they did last year. I don't know.
Okay.
If you've got any virus there, it's positive. The problem is false negatives. It's not false positives.
Okay.
The FDA, who okays these tests, they're very specific how these tests are done.
All right. So let me ask you a personal question here. I saw two presentations. Two renowned doctors. This was I forget where I saw it. Was on the news or social media or something. Two renowned doctors. One person was saying that so I watched both of them almost back to back. So one person said, "Oh, the virus escaped from a lab, but they felt, based on their experience, that it was actually let out on purpose so that we could develop a vaccine. And then once we develop a vaccine, then they're going to release the next virus, which will react with the vaccine and cause multiplied deaths." And this was that doctor's take on, that we're playing into this. Then the next presentation I saw, because as in just when a lot of people, you get a lot of links and things, was saying this is how the body works, this is the immune system, this is how it works, this is how vaccines work. Kind of the question I asked at the beginning: how do vaccines work? And this is the virus. And he had a total different take on the virus than the first doctor that I saw. I'm a layperson. I am listening to professionals, educated, with their statistics, and I'm lost.
Yeah.
I'm asking, I'm throwing it to you and the same with the same idea. If I was in your office, we're just having a conversation one-on-one, and we're just talking. It's not to say all the issues we're gonna make. It's not an anger issue. It's more just, it's frustrating. How is a regular average Joe or Joan supposed to make heads or tails when it seems like everybody's all over the place on this? What would you say to your patient if they were talking to you about that?
Well, I would say that you're going to find every kind of angle or theory you want to find, especially because the internet is a fertile ground for that sort of thing. And you can't prove that a conspiracy theory is wrong. It's very difficult to prove it wrong. So you have to decide where you're going to consider information as reliable as possible. And that conspiracy theorists may have their personal pet theory, but I think that going to sources that are more broadly understood and accepted by the scientific community is the best way of deciding if information has a better chance of being accurate. And that's really, you can find the craziest information you want to find, but the majority of public health professionals in this country, that's the information I trust. Realizing that our knowledge and understanding of anything, a new disease or anything, is going to develop with time. I read the reports on the investigation on the team that went to China about where did this virus come from. And even those well-accepted official reports from the team couldn't say there was no chance it came from a lab. You can't prove a negative. They said it did not seem to be likely. Plus, they were relying on how much information they got from the Chinese government, which isn't necessarily a fund of openness and, collaboration. So they didn't completely write off the possibility. And I think that's, they were being honest. They were being scientifically honest. This is what we see it, where we think it came from. We can't tell you it didn't come from a lab, but we didn't find proof of that. If that nefarious situation is what's going to happen, then I hope the Lord comes soon, because this world is going down the tubes. But that's not how I choose to live my scientific life, is by swirling around in the in the conspiracy theory fringes, I really try to look for the middle of the road information that is widely accepted by the scientific community.
I would say, in addition to that, is that there are unbelievable doctors and labs all over this world. It's amazing to me what they can do. I mean, they follow these mutations from the beginning of this disease. They know where it's traveled, where it's been. It would be pretty difficult for the Chinese government or any government to not leave their fingerprint all over this. Now, that's not really our scope of our thing tonight, but let's just say that there's 900 amino acids, and there's so much room to check a fingerprint where this came from that it's they know what the one came from England, what came from South Africa, which one came from Brazil, which one came. They just know all this stuff, and it's mutating all the time, and it leaves a fingerprint wherever it goes. So it's not like this is something that people can make theories, but there's no proof of any of this stuff. So, and besides, what difference does it really make? We have to deal with the cards on the table. I mean, we have to deal with the virus that's here. If the Chinese were so smart to do this, they have the dumbest vaccine of anybody. They would have killed themselves. The Sinovac vaccine is less than water. So yeah. They weren't. If you were going to poison the world, you want to have the antidote, and they don't have the antidote.
Yeah. That has come out in the past month or two, that the Chinese version of the vaccine is very ineffective. It's not working for them, unfortunately.
We have many comments. I'm trying to just look through some of these, and for whatever reason, I can't scroll down here. So there was a question about long haulers, or I guess concern about the effects of the vaccine on the body in the long haul. Have you heard anything? Is there anything you want to share about that?
Well, some initial information about COVID long haulers, people who got the disease and have symptoms 3 to 6 months later. They never got well. That's a long hauler. That's a person who got COVID and has never recovered. And some initial information shows that getting the vaccine in some of those patients helps them recover.
Okay.
What you have to understand about this virus is that it creates a lot of inflammation in your body. That the infection's gone. So these long haulers doesn't necessarily mean they still have the virus. What it means is that the effects of the virus, so the virus attacks like all the endothelial cells in your body, or the whatever part. A lot of them, it affects their brain. There's been a lot of neurological problems post-COVID, and then there's been heart attacks and strokes and all kinds of stuff, which people. One of my employees' husband was out of work for 9 months. He couldn't hardly walk across the parking lot. So out of the 600,000 people that died, how many, we don't know how many long haulers there were. Eventually, most of them seem to get better, but it takes a long time.
All right.
Okay. I do have a question here that it's on our Facebook. And again, we just want to say thank you for those who are watching and on Facebook and also on YouTube. But there's a question here, very interesting, that there's people saying about a passport. What about the vaccine passport? Do we ever gonna need a passport to travel? I mean, a vaccine passport to travel. What do you guys say about that?
Oh, that's a really good question. Because vaccines are not 100% effective, it's not going to be a 100% protective passport. Every country is going to have to make their own decisions about what makes sense for them in requiring vaccination for certain privileges. I think the jury's still out on how best to apply that sort of thinking. I don't know. What do you think, David?
I I don't think the government wants to get into that, but I think certain industries are probably going to require it. So if you work in I think eventually hospitals are going to require. I mean, we require flu shots. I believe they're going to require it in hospitals. Certain types of manufacturing are probably going to require it. If you're going to travel to a foreign country, you're either probably going to have 2 tests or a vaccine. I mean, that makes common sense. I mean, why do they want to have the disease brought in their country if they've been so diligent to get rid of it? So there's going to be some use of it. I don't think it will be the mark of the beast, though.
We're not going there, guys. So I guess on that point with the vaccine passport, it seems to me that you'd have to rewrite all the HIPAA laws because it should be nobody's business what my health is, what my medical situation is.
No, you're wrong on that, Miguel. Because the government already has the chance to. We already require TB testing for healthcare workers. If there's a compelling societal benefit, HIPAA doesn't cover it.
Well, that's disappointing.
Yeah.
Why?
Your privacy is not universal with certain health issues.
Well, I want to answer Dr. Foots why. Here's the thing, and again, I'm in your office as your patient, right? We got a bunch of people listening, but I've had people call me, and right out the chute, I say, "Hey, hello, this is Miguel. Can I help you? Hey, have you got your COVID shot yet?" It's not your business.
Exactly. It's not that person's business, but it may be the government's within the government's compelling interest for societal benefit. That's different. Okay.
Yeah. Okay. Well, we'll agree. I'm a layperson, and I'm gonna just defer on that one.
You may wish the laws were written that way, but they're not.
Right. Pastor Claudio, I think we scheduled to go from 8 to 9. I don't know what time is it now. It's 9:11. Oh, that's not a good time. We got to go at least a couple minutes longer.
Oh yeah.
I want first of all, thank you, and to everybody who's watching, thank you. There are questions we tried to get to we weren't able to get to all the questions. Some of them, to be honest, we tried to put them together. Both doctors, if someone has a question, would it be all right if they were to contact you?
Oh, they could certainly. Yeah. What's the best way to contact? I don't know. I'm on Facebook. I mean, you can. The advice you get is worth what you pay for it. Let's put it that way.
Yeah. Well, here's the thing for me. I had a conversation through email with Dr. Foote last week. A lot of your perception and your reaction to COVID, to the vaccine, and everything really comes down to who you trust.
Mm-hmm.
It comes down to who you trust, and someone can say something till they're blue in the face. If you don't trust them, you're not going to believe them. And so for me, I'm trying to encourage people, look, have conversations with people that you trust.
Yeah.
And rather than someone on TV or someone on the internet or some magazine, talk to people that you know. Even you don't have to agree, but at least someone that you can trust. And so that's why I asked that question.
Mm-hmm.
I have one more question for you. Oh, were you going to say something?
Let me just answer this side thing about trust. Obviously the people that on here don't know me. I don't know how they would have trust in me. But obviously I think most doctors, your own doctor, your personal doctor would be someone you should talk to.
Best person to talk to.
And getting back to trust, I think part of the reason there's so many conspiracy theories is that for some unknown reason in the last 30 years or so, people have in general, lost trust in science, lost trust in doctors, lost trust in politicians, lost trust in all authority. And I think people need to reevaluate okay, why do I trust some people and why do I not trust some people? And, learn about scientific principles again, reacquaint yourself with, what is a probability factor and what is, what are these studies that are being done? What's a phase 1 and a phase 2? Re-educate yourself with what the science, what true science really is. I mean, it built the Western world, and obviously we've made mistakes along the way. But if you don't believe, if you don't believe in the, data and science, I mean, you're going to go with whatever your feelings are, and that's kind of a dangerous place to be.
I'm going to share two more questions with you. One from the chat. Is there a difference in the effectiveness of the vaccines for people of different ethnic backgrounds?
I don't know that there's data on that yet, David. Do you know?
No.
I don't think there's data yet.
Okay. Question.
No, but the virus itself is much worse with many ethnic groups, partly because they live in a higher densities. Unfortunately, white people tend to be more affluent and more in the suburbs, and they don't live one family per household, and they can afford PPE and all the rest of it and medical care, and they get COVID a lot less than and less severe, and they get the antibody treatment if they have it. So I mean, unfortunately, it's very important for the minorities, less affluent people to get their vaccine. A lot of Asians, when they come over here, or Latinos, they live 3 people in a household. I mean, you can't control COVID when you have 18 people in a household. So, it's very important that those people get vaccinated, even more important than the white people that are living in the suburbs.
I do have a question here on our Facebook chat that I want to ask before we go. I think already, Beth, already addressed that. But once again, I think just to be clear, what is the best vaccine available? I mean, it is the most
one you can get.
All right.
And that is a direct quote from the Onondaga County Health Commissioner and from Dr. Stephen Thompson, who is the lead clinical investigator in the Pfizer vaccine development. The best vaccine is the one you can get. It's much more available now than when they said that. They said that about 6 weeks ago. So, like Dr. Foote said, if you're a woman woman of childbearing age, or if you're on birth control, you might want to avoid the Johnson & Johnson. And you can't get the AstraZeneca because it's on, and they're both on pause right now. There really is nothing negative to the Moderna or the Pfizer, except if you have a history of reaction or of allergic reaction to a vaccine, you might be better off with a single dose vaccine. Because if you had a bad reaction to dose 1, they may be too scared to give you dose 2. So if you get a single dose vaccine and you have a reaction, oh, okay, you're done. You made it. So, that right now the single dose is off the market, but it's probably going to come back. Johnson & Johnson, I think, will come back. So for people who were worried about, I had a close friend who did exactly that. And they got their Johnson & Johnson one day before they did the pause. And they were very relieved that they were able to get that vaccine. Because otherwise they would have been stuck with no option, because nobody was willing to give that person a 2-dose vaccine because that person had reactions to vaccines in the past. And they did fine. They've had it over a week ago. They had no reaction whatsoever.
And I would say people that have had COVID and want to get vaccinated, your one shot is probably a better one, because you're going to have more reactions to, once you've had the antibodies, you're going to have more of a reaction. So if you have to do that twice, it's going to be disheartening. But with the J&J, you just have to do that once. So, they recommend, sometime between 90 and 120 days, you probably should get vaccinated, because your antibodies are dropping off. And so if you're going to get a vaccine after having COVID, which is recommended at some point, I would go with the one-shot one.
Okay.
And the other thing about the one-shot one is J&J. It's been actually tested in much more difficult circumstances. South Africa, Brazil, and Latin. Yeah. So they've proven under fire that the other ones haven't.
Yeah.
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 And one more question here. I'm sorry, Miguel. It's my time now to
Absolutely, go for it.
I wanna just take advantage of this opportunity. A lot of people sometimes they don't like to go to see the doctors. It's the reality, right? They don't like to see the doctors. And sometimes, and most of the time, because they don't go to the doctors, they don't know the medical background. They don't know the history, and sometimes the fear of not knowing if I'm gonna get a reaction from something, it could be quite a challenge for some people. So what would you say to somebody like that who does not the history, the medical history, and they are thinking about their vaccine or not? How should we approach that situation? What would you say to that person?
In my opinion, I almost think that ignorance is not a bad thing. Because if they've not had a bad reaction to a vaccine, then they're okay. And so if they haven't gone to the doctor, they haven't gotten very many vaccines, they've never had a reaction, they're fine. It's the people who know they've had a bad reaction to a vaccine that we're more cautious about.
Okay.
I don't know. What would you say, David?
I'm not certain that was your question. What do you do with a person who hasn't had exposure to medical care before?
That's correct. Yeah, some people don't like to attend to just to visit the doctors, and they don't know what's the background, the medical history. I guess they don't have it because they just don't visit the doctors.
Well, in New York, none of the private clinics have been given vaccine. You have to go to a pharmacist or a state county vaccination site or something like that. So you don't even have to go to the doctor to get a vaccine.
And they really don't care about your medical history other than to say, have you ever had a reaction to a vaccine? And if the answer to that is no, not that I know of, then really you're not at increased risk of having some disastrous outcome just because you don't know that much about your past medical history. It's kind of paradoxical. You're almost, nobody's really worried about the patients who don't go to the doctor. They're worried about the patients who know they've had a reaction to a vaccine. Yeah.
All right, Miguel, you up? Or if you want, if you want, I can ask one more.
Sure. Go ahead, and then we're going to be wrapping this up. So
yeah, just we were talking about earlier about trust and resources and where can we go? I'm sure there's still people out there who still trying to research and do things for themselves. So where can we go to find reliable resources? Sources, for us to have information that will really educate us, and we're going to be able to make smart decisions about the things that we have to do, especially when it comes to our health. Where can we go? I know we talk about it going to the doctors, but is there anywhere that we can, search, look for? I don't know.
That's a really good question, because honestly, early in the pandemic, I struggled to find information that answered the questions I had. The county, whatever county you're in, like Onondaga County .gov and the New York State COVID information websites have really become very informative and very up to date. And the CDC has stuff that's well written and pretty easy to understand, but sometimes it's hard to find the piece of information you want because the CDC is a huge website. So I would start in your own county and then go to the state and then go to the CDC. But your own doctor is going to have the most personalized information. They're going to have information, and then they're going to know about you. So that's going to be the best source.
All right.
And I really think most physicians right now of all specialties are really motivated to help their patients navigate these kind of decisions. I'm doing it, and I'm not a primary care doctor. I'm asking everybody in my office, is your family vaccinated? And if not, why not? Can I can I help you with that decision?
Good. Well, thank you. All right, Miguel, you up?
Well, there's some more questions that are coming, but we're gonna close the program for now. So I want to thank you. Dr. Burkhardt and Dr. Foote, for being with us. In some ways, I felt like we were putting you on the spot because some of the questions, the people have questions, and so I hope that we were able to get to some of them. We weren't able to get to all of them. I apologize for that. But if you want opinion on your questions, call me. If you want answers to your questions, call one of them. Let me just share a couple concerns that I have, and it has nothing to do with the doctors. It has to do with the issues surrounding the vaccine and the virus. There's an incredible amount of division, and kind of goes back to what Dr. Phil was talking about with this trust issue. There's an incredible amount of division in our country. We're divided along racial, political, and even now scientific lines. The concern that I have is that has entered the church in some fashion. And if John Smith chooses not to get the vaccine and Jane Doe chooses to get the vaccine, there are those that want to make them sit in separate parts of the church. And maybe there's some benefit. I don't know. To me, I see that as a huge mistake, spiritually speaking. We've got to figure out a way to not let this thing split our church. That's a concern that I don't have the answer. I'm saying that we can't let it split our church. Only one person wins when church members are split. Only one. And if you think that that we're better off divided, then we have nothing to talk about, because I don't agree with that. I don't have the answers, but there's certainly, this thing is dividing the church. The goal for me to be here with you was to ask questions of people who are in the medical field, who have more information and more understanding than I do. I don't have that understanding. And so I want to encourage everyone that's watching that however you're responding to this, yes, you have information. Yes, there are sources you trust. But you know what? If you were diagnosed with cancer, you wouldn't be calling Pastor Crespo. You wouldn't be going to YouTube. You'd be going to your physician. You talk to them first, and then you'd get a second opinion. Then you probably would get a third opinion, but there would be people that you would talk to face to face, people that you could look them in the eye, not just take what people who are online are saying and presenting information on. I think we need to do that same thing with COVID and the vaccine. However you're going to respond to it, talk to a person, talk to your doctor, the same person you go to for any other health advice. I don't have an answer, but we have got to get beyond trying to, in the church at least, test each other by asking these questions, because it's causing division. And if Jesus is coming soon, if he's coming soon, is this what he wants us arguing about? I don't see it. I struggle with this. We should not let the division that's splitting our country, we cannot let it split our church. And so my appeal is for us we have to love each other. We don't have to agree. Again, it comes down to who you trust. But we certainly need to love each other. And there's a world out there, dying from COVID is bad, right? Pneumonia, you can't breathe, you don't have any energy. If you're not dying and it's really bad, you probably wish you were dead. But what if you died without Jesus Christ? That's worse.
Can I just say one thing? I'm somewhat optimistic. Now, maybe I'm not in your shoes, but I'm overly shocked that the number of people who have gotten vaccines already in my practice. I know the news wants to make, they want to make conflict. They want to make one side against another. That's their job. That's how they sell their business. But in the real world, where I meet a patient in the room, I'm shocked at the number of people who, it's like 75% of people over 65 have gotten the vaccine. I mean, it's everybody I ask has got it that's over 65. Now, the younger ones, it's a little tougher, but, I'm optimistic that as more and more people get vaccinated, that even if they don't understand the scientific principles, they'll see that, hey, this is a good thing. They'll just see it with their own eyes. So I'm optimistic.
Well, we're gonna end on optimism.
Here we go.
I want to thank you both for joining us for the indicator, Pastor Claudio. I turn the last few seconds of the program back to you.
No. Thank you once again so much for being with us tonight. Really appreciate it, Dr. David, Dr. Beth. Thank you so much. And we also appreciate everyone who has been being able to join us tonight through Facebook and YouTube. Thank you so much. We need to keep praying for each other. Let's remember that we have a mission to complete. Jesus is coming soon. Let's put our minds and hearts together because Jesus is really coming soon. Let's pray. Our Father, thank you so much. Thank you so much for your blessings. Thank you so much for the resources that you provide. Those who went to school to spend time studying and learning so people like us can be educated and learn about how we can take care of our health in a better way. Thank you so much for what you do. Thank you so much, Lord, for your blessings and the way that you have provided for us. Once again, we say thank you for who you are and thank you for the things that you do. It is in Jesus' name, and this is Jesus' name that I pray tonight. Amen and amen.
Amen.
Bye.
Good evening,
Good night.
everyone. Happy Sabbath.
Thank you. God bless you.